In this video, we are going to demonstrate about various methods of contraception. At the end of this video, you can able to demonstrate different types of contraception methods available in Sri Lanka, their mode of action, efficacy, contraindication, and how to use them in practice and how it will return to fertility. There are various types of classification available for contraception. However, I would like to describe an easy method of classification. Basically, the contraception is classified into permanent method, temporary method, and natural method. In temporary method, it can again classified into short-term methods and long-term method. Short-term methods, either hormonal methods or non-hormonal. In the short-term hormonal methods, combined oral contraceptive pills, progesterone-only pills are available. In non-hormonal methods, usually in barrier methods, males and female condoms are available. Long-term methods are called long-acting reversible contraception. It's again either classified into hormonal methods and the non-hormonal methods. In the hormonal methods, injectable progesterone like Depo-Provera, implants like Jadale and Implanon, and levonorgestrel intrauterine system, Mirena, these are the examples. Non-hormonal methods, copper IUCD is a common example. In permanent methods, it's a permanent sterilization. It can also be done to the females and males. In females, the female sterilization mainly targeting the tubectomy, and the male sterilization mainly targeting the vasectomy. I would like to explain medical eligible criteria before describing this contraception method. Medical eligibility criteria was formulated by WHO to ensure the safety of various methods of contraception for a specific health condition to the women. We will see a detail of medical eligible criteria. Category 1, a condition for which there is no restriction for the use of contraceptive method. Category 2, a condition where the advantages of using the method generally outweigh the theoretical or proven risk. Category 3, a condition where the theoretical or the proven risk usually outweigh the advantages of using the method. Category 4, a condition representing an unacceptable health risk, that is contraindicated. Now, you can see the medical eligibility criteria wheel, which is available in most of the gynecological ward for the easy usage in practice. First, we will see the combined oral contraceptive method, which contains estrogen and progesterone, which is commonly used, cheap, available method. Now you can see the combined oral contraceptive pill. It has a 21 white color tablet consists of combined hormonal contraception, and there are 7 red color tablets which consist of iron. Usually, it is started on the day of menstruation, or we can start it within 5 days of menstruation, and we can continue the iron tablets during the menstrual flow. The mode of action of combined oral contraceptive pills is giving a negative feedback mechanism on the hypothalamo-pituitary-ovarian axis and prevent ovulation. Now, we will look into how we can manage a woman missed pills. If a woman missed a pill, 1 or 2 hormonal pills on a consecutive days, we will advise her to take the pills as soon as possible and continue the same packet. No need for the additional family planning method. If a woman missed 3 or more pills as a consecutive day, we will advise her to take the hormonal pills as soon as possible, but she needs to take additional family planning methods or avoid sexual activities for next 7 days. If she missed an iron containing tablet, that is not a serious concern. She discard the missed pills and continue to take the rest of the iron pills. Usual common side effects of this oral contraception: nausea, vomiting, abdominal bloating, but it is more palatable and easy to use. According to the medical eligibility criteria, we can prescribe to the women. Next, we will move to the barrier methods. It either might be a male condoms or female condom. Male condoms are usually commonly used and freely available in all the places. Usually, it is used as barrier method
to prevent the sperm entering into the female genital tract.
Usually, it is placed in the erect penis before the sexual intercourse. Next is a female condom, which is not commonly used in practice. However, it's available in certain places. This is a female condom, which is usually placed in the vagina of the woman before the sexual intercourse.
These both methods are less reliable
because during the sexual intercourse it can burst, but it has a protective action against the sexually transmitted infections. Now we will move to the long-acting reversible contraceptive method. In that, first I am going to describe about the injectable methods, that is DMPA, Depot-Provera Methoxyprogesterone. This is a progesterone which is given as an injection in a 3 months interval, which is act on the hypothalamo-pituitary axis and making a negative feedback mechanism and prevent the ovulation. More than that, it can thicken the cervical mucosa and prevent the sperm penetration into the cervix. The common side effects of DMPA: menstrual irregularities, weight gain, and sometimes abdominal bloating. However, it is a long-active, cost-effective contraceptive method. And after 3 months of usage, it will return to the fertility without any delay. The second long-acting reversible contraception method is injectables. Progesterone injectables. 2 commercially prepared methods are available in Sri Lanka. One is Jadel. And this Jadel have 2 rods, and other one is Implanon that has a 1 rod. So it's same like injectables. It can place any time of the menstruation. Injectables have a progesterone which is act on the hypothalamo-pituitary axis and make the negative mechanism and prevent the ovulation. The common side effects are menstrual irregularities, amenorrhea, and bit of weight gain. However, its efficacy is much more good and well recommended to use for the contraception. Now you can able to see a small animation of demonstration of this Jadel insert. Next long-acting reversible contraception method is levonorgestrel intrauterine system. That is called Mirena. So this is a levonorgestrel intrauterine system which contains the levonorgestrel like it is implanted in the intrauterine system and it's placed in utero. So it acts on a endometrium and make the endometrium to prevent the implantation, and it has some progesteronic effect as well. More than the contraceptive method, it can use for the abnormal uterine bleeding also. It can be used for 5 years. The common side effects are menstrual irregularities, perforation during the insertion, vasovagal attack during the insertion, and sometimes a long amenorrhea. The next long-acting reversible contraception method, non-hormonal, is a commonly used one, copper IUCD. So this copper intrauterine device, which is ideally can insert at any time but preferably soon after the menstruation. It is placed and it can keep for 10 years. The common side effects are menstrual irregularities, spotting, and sometimes perforation during the insertion. it also acts on the endometrium and prevent the implantation. Now we can see how we can insert the copper IUCD. I am going to demonstrate how to insert the copper IUCD. First, I am going to demonstrate in this model, but you have to put the patient in the lithotomy position, chaperone and adequate light. After that, you can insert the cusco-speculum and visualize the cervix. Now you can able to see the cervix and the external os within this speculum. After that, you have to assess the uterine size and the orientation. For that, we are using the uterine sound. This uterine sound is used to assess the uterine size and the orientation. Inserting through the cervical os, we can easily understand whether it's an anteverted uterus or the retroverted uterus and the size of the uterine cavity. Now, you take the copper IUCD and place it properly in the applicator. Now, you can see it is properly placed in the applicator. According to the uterine size, you measured and placed this blue color knob according to the uterine size. Now, you can able to insert this applicator through the cervix gently and place in the external os. After that, you can use this stilate to push the IUCD into the uterine cavity. So now I am gently pushing the copper IUCD into the uterine cavity. After that, take both out and you can see the thread. According to the size, you can trim the thread. Next, we will move to the permanent methods. It also can be done to males and female. First, we will look into the females. Basically, we are disconnecting the tube and prevent the ovum to meet the sperm. We can achieve this by three methods. One, open surgical technique, in that we are ligating and resecting the tube in the ambulatory region bilaterally. That is a common method used in our country. Second, laparoscopic female sterilization, in that we can clip and disconnect the tube bilaterally, or we can put the rings, that's called fallope rings, in both tubes to disconnect. Third one, hysteroscopic method, which is not available in Sri Lanka, but we are inserting the microstillates into the ostium to prevent the sperm to meet ovum. Likewise, in males, the permanent sterilization method called as vasectomy, in that they are disconnecting the vas deferens to prevent the sperm to get into the female genital tract. Currently used criteria for sterilization in Sri Lanka is the client should be over 26 years of age and should have at least 2 children. The younger child should be more than 2 years. Or client over 26 years age with 3 or more living children. Or if a medically contraindicated woman according to the Merck criteria, Merck 4, with a specialist assessment and approval, she can go for a permanent sterilization. Finally, we look into the emergency contraception. There are 3 types of emergency contraceptions are available. First one is a progesterone emergency contraception, which is freely available. Second one is a copper IUCD. And third one is a oliprostol acetate, which is not available in Sri Lanka. We will see one by one. First, progesterone emergency contraception, which consists of levonorgestrel, which is we can use within 3 days of sexual intercourse. It can be used as a single dose or divided doses in 12 hours apart. But it is not recommended to use more than in a one menstrual cycle. The second one is copper IUCD, which also can be used as emergency contraception within 5 days of sexual intercourse. Thank you.